Member from Perth-Wellington.
Thank you, Mr. Speaker. My question is for the Minister of Health and Long-Term Care. It concerns this government's lack of consultation before cutting family doctors, and specifically the new Graduate Entry Program, or NGEP. I've given the minister a copy of the letter he received from the chair of the Department of Family Medicine at Stratford General Hospital and the president and CEO of the Huron-Perth Healthcare Alliance. And here's what they had to say about the government's changes. They will almost certainly spell the end of the involvement of family physicians at Stratford General Hospital. And so I have to ask the minister, can he see how seriously this would damage health care in communities like ours, and how does he respond to the HPHA's concerns?
Good question.
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker. And I really appreciate this question because, I need to first of all stress that earlier this year we made some changes to incent our family doctors to join family health teams in the high-needs parts of this province, and I think all of us would support that laudable goal. However, we also saw that there are family doctors who have done their training in a family health team environment and maybe don't have the opportunity for a variety of reasons to practice in a high-needs area. So we created this program as an opportunity, but I want to stress that it's 100% voluntary, this program. It doesn't force any physician to do anything, and in fact, it's just specific to those areas which aren't high needs. But it does point out a very important challenge that we face, because many months ago and repeatedly we shared our ideas with the OMA, with the Ontario Medical Association, in great detail in terms of what we were thinking, Mr. Speaker.
Answer.
And throughout those many months and repeated efforts, we did not get a single response, a single piece of advice, any advice from the OMA whatsoever.
Supplementary.
Speaker, the HPHA is very clear. Policies designed for large urban centres very often have unintended consequences in small and medium-sized communities. We're told that in our local hospitals, family physicians may no longer be able to care for inpatients because of this government's changes. We're told this could add millions of dollars to our hospitals' budgets that haven't seen an increase for 4 years. We need to know this minister is listening. When it comes to the NGEP, doctors and hospitals and small communities do not want it and did not ask for it. Will the minister fix this?
Good question.
Well, Mr. Speaker, we created this program for new grads because we were listening, and we were listening to medical students and new grads and family doctors. But I want to emphasize that we repeatedly and for many months shared our proposal, and it was simply a proposal at that stage since late last spring with the Ontario Medical Association. They obviously didn't share it with their membership. So we created a program, and after significant stakeholder consultation, but without any input or advice whatsoever from the OMA. Fortunately, Mr. Speaker, the Ontario Council of Family Practitioners were not going to be part of that silence, and they came forward with a number of recommendations, including specific recommendations that I'm confident are going to address the specific concern from the Huron-Perth Healthcare Alliance, Mr. Speaker.
Thank you. New question, the member from Parkdale High